Hi, everybody. I'm Zachary George. I'm a clinically licensed therapist, and this is Practically Social. Today, we'll be covering my top 5 reasons you're avoiding therapy. I will be reading these off my screen today, so if you see me looking down, it's not that I'm not paying attention to you. It's just that I have a lot of material here to cover, so I will be referring to my notes on that rather than trying to memorize all of it. So here we go. Number 1, therapy wasn't your idea. If the reason you're in therapy is because someone else told you to go, it's a condition your partner placed on your relationship, a request from your boss, or you were arrested for DUI or possession charge, and the court ordered you to attend substance use treatment, odds are you don't want to go for a variety of reasons. But the top reason is it wasn't your idea. I encourage you to go even if someone asked or told you to go, and yes, even if you're dreading it. The best reason to go to therapy is because it was your idea. This matters because the desire to go on your own develops the best results. We know that from both experience and research. Therapists are also trained in motivational interviewing, a theory that was developed in the medical community for treating those people for health disorders that actually didn't want to change on their own, even though they knew their health depended on it. That included things like dental health, diabetes, obesity, and more. These folks didn't want to go to treatment on their own, and they didn't want to make these types of changes. They were reluctant to do so. It's the best factor for success in therapy or treatment. Just because someone wants you to go doesn't mean that's the best idea for you. Because it wasn't your idea, A, and B, we know if it's not your idea, it will be less successful. Some people are forced into treatment and are successful, but for the most part, they resist the change until they are ready themselves. However, if you believe that therapy could help you and you're open-minded about it, your chances of success are already raised. Here are a few exceptions to someone recommending you to go to therapy, though. Anyone may benefit from some individual therapy, though being motivated to begin is a multiplier for success. Many child welfare agencies, the military, and emergency agencies, and schools recommend therapy because it helps individuals address their problems in a neutral place that is well equipped to offer guidance and support. This guidance and support is best offered outside of the institution that recommended the therapy and occurs with trained professionals who can handle crisis, ongoing support, and direction to community and other resources. Think of therapy under these circumstances as having a neutral helper when you need it most, in a safe place where coping strategies and validation can occur. Recommended therapy for children under these circumstances generally is very helpful because children cannot advocate for themselves or find resources for help in the adult world after such trauma or negative experiences. Children may have no one else to confide in other than a paid professional, sadly. Such therapy could be a lifesaver and prevent years of ongoing pain in some circumstances. EAP, or your therapy benefit offered through your employer, is another example that may be a benefit even if you were reluctant to go in the first place. Your employer or yourself may have chosen therapy to address poor performance, burnout, divorce, grief, or other substance use issues. Furthermore, as substance use and mental health therapists, we do see some success with our court-ordered individuals in treatment, often those who are at a point where they think stopping substances or avoiding them will alleviate their legal troubles or improve their life overall. Many people who didn't want to attend treatment find success because the services they received were welcoming, non-judgmental, client-centered, strengths-based, offered tools, and were supportive of their success. Just remember, the key factor is that if you don't see the value in therapy for yourself, there probably isn't much value at all. I hope you'll give this some thought if therapy isn't your idea. Number 2, the second reason you may avoid therapy is that you don't know what to expect in therapy. Therapy for people who've never done it before is usually intimidating or frightening. Therapy can seem especially scary for those who have read bad reviews, seen movies that portray therapy badly, have a family that isn't supportive of therapy, or heard horror stories. The media, family, and society all shape the way that we may view therapy or mental health care, or substance use treatment. Therapy is often seen by many people as useless or the last resort instead of the first. They've had negative experiences or been subjected to misinformation that therapy just doesn't work, is a waste of time, is for the weak, or is just someone trying to get in their head and make money. These are all myths. Quality professionals will reassure you and help you get on track, that help is right for you. They understand that if your relationship doesn't work with them, they will still want you to find a relationship with a therapist that does work. If you're new to therapy or considering therapy, I recommend you watch my Intro to Therapy video. I'll leave the link in the description to this video below, or you can find it in my mental health therapy playlist along with all of my other videos. If you are at this point in the video and you're not a subscriber, please help support this free content by subscribing, liking, sharing, and commenting. Moving on, let's look more at why people might be afraid of therapy. I believe the most important of these is simply trusting the therapist. Most of us don't feel comfortable expressing our thoughts, emotions, hidden secrets, or shame to strangers. Keep in mind that your therapist is sworn to confidentiality and will respect it first and foremost. If there's a legal reason to break that confidentiality, they will tell you why and walk you through that. This usually means if someone is suicidal, homicidal, or children are being hurt or neglected. This is law in most states, and it's called duty to report. It is not a reason for your therapist to disclose anything else you said in your sessions, and they are ethically bound not to except under a judge's order. Be sure to check your state laws on this. Second, it won't take long for you and a therapist to develop some mutual trust. Feel free to ask questions about your therapist and get to know them. Therapy is designed to be a safe space to express feelings, thoughts, secrets, and concerns. Advice and feedback are optional, and you may go at your own pace. Number 3, risk and reward. The third reason you may be avoiding therapy is related to risk and reward. Many of us prior to starting therapy thought we'd be risking ourselves by sharing what happens in our private lives, that we'd be judged, and that there wouldn't be any reward or success, no improvement. We know that therapy isn't a cure for our problems, but it should help us cope with them, right? We want to feel like we're making progress. Some people believe that therapy is designed to make them feel good after every session. Others may think therapy will make them cry every time they visit, or that therapy will only address negative things. When therapy focuses only on the negative, or what a client's psychological condition is, we call this a problem focus. The problem focus makes us feel like we are only risking, perhaps also being judged, without knowing what the reward will be. But hang on a second. A good therapist doesn't judge you as a person on your morals, beliefs, or lifestyle. A great therapist uses their clinical judgment to help guide you to effective treatment of psychological conditions. Effective therapy must include a range of topics important to the client, as well as techniques and tools that are evidence-based. I prefer to use tools and techniques that are easy for my clients to master and gauge their own progress with. More on that in a second. Therapy is also useful for working through negative emotions and thoughts, addressing relationship struggles, low self-esteem, grief, gratitude, resiliency, strengths, and achievement of your goals. Good therapy will include laughter, joy, trust, and hope. So if you think that the risk of going to therapy is too great, remember that you can work through the hard parts with help, and the reward is your personal growth and triumph. Number 4, competence versus confidence. Often people seek therapy because they wish to gain confidence. A lack of confidence is brought about by a collection of experiences, generally negative in nature, that has either prevented or slowed confidence building. Some experts agree that we cannot have confidence without competence. As we build competence or mastery of those things which have disturbed us, we develop confidence. One example of a tool in practice is to build confidence when we're able to counter negative thoughts which dominate us and cause us anxiety. We counter these thoughts with alternative thoughts, which are less negative, neutral, or positive. By simple practice with these tools, we become more skilled or competent, and therefore can become more confident. For examples of some of these tools, check out my video on CBT basics in the links below. In summary, therapy invites us to use tools and skills that open us up for growth when we're willing to have the courage to share what makes us uncomfortable, what causes us pain, and why we are struggling or asking for help. Vulnerability becomes a strength instead of a weakness. We can learn to trust others by being vulnerable with a trusted therapist. In the beginning of therapy, you may find your confidence and your competence in dealing with emotions, reactions, and distractions low or difficult. In time, as you practice the skills, become more comfortable discussing your emotions, reactions, and distractions, your overall competence and confidence will grow. With a good therapist, you should be able to see some results after only a few sessions. Number 5, the final top 5 reason you're avoiding therapy is pain avoidance. Pain avoidance is a particular term for describing what people who are already in therapy may be experiencing and can involve all the previous reasons I talked about. Pain avoidance is a natural human condition. People in therapy often stop too early. Therapy can make us feel good in the beginning because we have someone who's willing to help with our problem, yet they aren't personally involved in it. They can provide us a listening ear, validation, reflection, and feedback if we want it. The disappointing fact is that when therapy starts to address feelings and thinking processes, people often drop out. They're experiencing the discomfort of doing things they're not used to, such as setting boundaries, being more assertive, processing their inner beliefs, and attempting to make changes to their usual way of doing things. They may be addressing their childhood, their anger, fear, confusion, and powerlessness. The challenges, tools, and homework we give as therapists to address their concerns often make people want to stop. It's a bit like physical therapy, painful but useful in healing. For example, have you ever ghosted your therapist? It's more common than you think. As a therapist, I offer all the comforting aspects of therapy and I listen and understand. However, the responsibility for change is with my client. The client is the one who gets to claim their victories, not me. So when I ask clients to do the work, there's a sense of hope and reward that I trust they can obtain, but they have to be willing to work at overcoming their specific challenges. To further the analogy with physical therapy, I'll illustrate. Therapy is much like doing workouts for your brain. They aren't academic workouts. They're workouts with emotions and include critical thinking or thinking about your thinking. Most people who start working out end up going hard on it, looking for a drastic change. And when it doesn't occur, they give up. They went through all that pain, but didn't see an immediate result. They know how difficult it is to keep a regular routine, to have self-discipline, and to complete the exercises. Therapy is the same way, except that the rewards are healing to your inner self, not the outer self. This work and rewards develop self-love, communication skills, and fulfillment rather than building muscle or losing fat. Keep in mind that your effort will pay off far more than the pain you're experiencing. It might have to get worse before it gets better, though the end products are infinite and surprising. There you have my top 5 reasons for avoiding therapy. Tune in next time when I will be discussing trauma. As usual, like, subscribe, share, and leave comments, including any topic you'd like to hear discussed by a licensed therapist here on Practically Social. Thank you and see you next time.